Yesterday, rapper DMX was sentenced to 1 year in prison for tax fraud and evasion. The embattled rap star has a history of legal issues, including drug problems. Now, DMX, whose real name is Earl Simmons, has been in jail since January for failure to obey conditions of his bail, which included drug treatment. The big question is, though, rehabilitation. Is it really possible for long-term drug users? And what does that mean as we battle this opioid crisis, which is the worst drug crisis we've ever had in this country? Here now to discuss, Janette Nesheiwat, the family and emergency medical doctor, along with conservative commentator Kirsten Haglund, back with us. Doctor, let me start with you. The CDC putting out an updated report on these 63,000 overdose deaths a year. President Trump hitting this really hard. Everyone understands the magnitude of this. But yesterday, the judge gave this rapper a break after listening to a song or a rap of his life story. He feels sorry for him. He cannot kick his drug habit, but he's got to put him in jail. What does this mean for everyone else? This
is very sad. It's disheartening and it's unfortunate. But putting him in jail, Charles, may actually save his life. He needs rehab along with the 2 million other addicts in this country.
And I think he's had it like 4, 5, 6, 7, 8 times.
Not for 7 days or 30 days. He needs prolonged, effective, evidence-based treatment. And the good news is that I was just at the White House opioid summit recently, where our president, he laid out his agenda on what he's going to do to tackle this opioid crisis, starting with allocating millions and millions of dollars to prevention, education, treatment, rehab, and recovery. Exactly what we need, because over 100 people die each year, each day.
Yeah, and of course, the largest demographic are males, 25 to 45, Kirsten. That number up 35% in just 1 year from 2015 to 2016. Again, you know, we know there's a huge economic toll. This is societal toll. And you wonder, you know, if we can't get prevention, you know, how do you handle all of these people in the system that are already addicted?
Yeah, well, obviously detox is number one, the most important thing when recovering from any addiction. But the two are not mutually exclusive. You can arrest and have people pay the legal consequences for either dealing, distributing drugs in the way that, you know, many have, but they can also get rehab as well. You can do the two together, and there are many prisons throughout the United States who actually have shown that they can have effective rehabilitation programs within prison. So the person is paying the consequences for their crime if they have dealt drugs illegally, as well as getting rehab. But I think the most important thing to do is to help destigmatize, especially for males, mental health treatment, because a lot of the reasons that you see overdoses is people feel it's not that big of a problem, they're not necessarily affected, and men feel like it's weak if they seek help. So talking about it on shows like this helps men in that age group to be able to say, hey, I need to get a handle on my life and kick this before it really becomes more serious.
Doctor, you mentioned being at the White House summit. President Trump pushing really hard. He wants a border wall. We know when it comes to fentanyl, I think 80–90% comes through the border. It just makes so much sense, again, that it would pay for itself in a number of ways, including the economic toll and the destruction of society.
Yes, and that's just one of the ways he wants to help combat the opioid epidemic. In addition to that, there's an effort to decrease the amount of narcotic prescriptions that are written by about 1/3. And we have to provide education to healthcare providers to make sure that they are not over-prescribing narcotics and using alternatives. Another good thing is that they're working very closely with the NIH to come up with more alternatives, non-addictive medication treatments, which is really a step in the right direction.
You're one of the more optimistic people I know. How do you feel that, are we near an inflection point on this crisis, you think?
Well, the awareness does a huge amount. And honestly, for any family that's at home watching, families are the first line of defense in this epidemic. So just in the same way that you would treat cancer or any other physical ailment and get treatment immediately, do the same with mental health, and we'll all save lives.
Ladies, thank you both very, very much. Appreciate it.